doctor is in. With nearly a year spent in crisis mode, many people are feeling pandemic fatigue or burnout. While the vaccine rolls out, a local non-for-profit is here to help us with a way to continue to slow down the spread of COVID-19. Joining us to discuss New Year's resolutions for the new normal is Dr. Cathy Emmet, a clinical practice specialist with Empath Health. Welcome to Bloom, Doctor.
Thanks for having me.
It's great to have you. And while most of us are focused on wellness goals now in 2021 and staying healthy, with the pandemic, the past year brought some new considerations. What are those?
Right. You know, with the new year, we are so focused on resolutions and being healthy, but now is not the time to let down our guard about this global pandemic. It's still with, and so we still need to be practicing the safe practices that hopefully we've all been doing for the past almost a year. And that's to have physical distance, such as we have here, of 6 feet or more, to make sure we're wearing a mask, and a mask that really fits snugly over the face, covering both the nose and the mouth. If when you talk, your mask drops below your nose, it doesn't fit.
Right.
And so you need to get a new mask. And it's also important that the mask have 2 layers of cloth, at least, in it. And then finally, the frequent hand washing or using hand sanitizer.
Because, you know, at Empath, you regularly care for patients with infectious diseases, and you follow these robust protocols that have been put in place along with the CDC. But you say maybe some of us are not doing it quite right, because you do see people talking to you with the mask below the nose, or they're adjusting it and bringing it down to talk and bringing it back up. And, you know, we've got to stay in compliance until everyone can get vaccinated that needs to get vaccinated, and we can maybe create some, you know, herd immunity.
Exactly. Now is not the time to let our guard down, as you said. And we're trying very hard at Empath Health to protect not only our patients and families and their caregivers, but also our own staff and our own volunteers. And as you mentioned, we do follow the CDC guidelines for wearing the PPE and wearing it appropriately.
So we were talking about the vaccine as well. The new year also brought new hope with the deployment of the vaccine. Should people remain vigilant even after they get vaccinated?
That's a wonderful point. I think a lot of people think, okay, I'm going to get the vaccine and then I'll be protected. I don't have to worry about any of this anymore. The vaccine is incredibly effective, it appears from all the studies. However, it's not 100%. And so we want to make sure that we're protecting ourselves and others, because we know with this virus, you can be infectious 2 days prior to even having symptoms. And we also know some people get the virus and have no symptoms, and they're infectious during that time as well. So we must all do our part to protect ourselves and others by following the guidelines.
It really is interesting how this is not a one-size-fits-all virus. I mean, each person receives it so differently.
You're absolutely right, Gail. I had the opportunity to work very, very closely with our patients and families and our own staff that had contact with this virus. And really the only consistent symptom we saw was that loss of taste and smell. If somebody had that symptom, they had the virus. Other than that, you know, anywhere from fevers to cough to just not feeling well. And as I said earlier, some people had no symptoms at all.
Yeah, we've talked to several infectious disease doctors on the show, and they said that is the one thing. If you're not smelling and you're not tasting, really no other virus presents that way other than COVID-19, which is interesting. So where can people find more useful resources like the tips that you've shared with us today on Bloom?
Sure. Well, as a not-for-profit organization that works with individuals in the community who are dealing with chronic and advanced illness, we do offer an integrated care network, and we try very hard to work with people on their journey and provide resources in both English and Spanish. And they can find those resources at our website, which is empathhealth.org.
All right. I'm going to read that again for you because I know you're going to want this information. Again, this is a non-for-profit here in the Bay Area doing so much to help us stop the spread of COVID-19. You can visit empathhealth.org. Thank you so much, Doctor.
Thank you very much.